go ahead and take off here. My name is Jason DeLeon. I'm one of the EBU trainers for those of you that don't know me. So I've currently been specializing in EBU and ozone IVs. So that's what I do here at MedMasters. But Lexi, if you want to jump in and say who you are. Lexi, before you get started, I want to make everybody aware that this is a series of 3 webinars that we're launching. So this is the very first one. So this is, Master the Power of Peptides and Ozone and Procaine in Aesthetics. From there, we are then moving into part 2 and part 3. So you want to make sure that you're signed up for these. If you have not signed up yet, there should be links going out to you for you to enroll. It's also going to, I'd say, cap out at a in-person training session in Indiana with Lexi, with Kim Look, to teach you on all these modalities. So to set the correct expectation for you guys here joining in on the webinar, if you're looking at sourcing some of these peptides or different concentrations that you're using and so on, this isn't the place for it. We truly want you in person where we can take our time and show you from A to Z and get you competent in some of these therapies. This is just a great overview for you to start laying the foundation and learning about ozone and peptides and just maybe leveling up your own practice as well. So just wanted to share that with you guys. Lexi, you can take it away now.
So my name's Lexi. I'm a nurse practitioner in Indiana. I have 2 functional medicine practices. We also do aesthetics. I've been doing this a fair amount of time now, and I love to teach, love to train, love to learn new things, love to try different modalities. And I'm looking at the roster here, and I see there's quite a few members from my training academy that are in here. So this is going to be fun because they know how my brain works and how I talk fast. So they'll have some, I think, Jason, really great questions because they have some of that foundation, which I think is so, so key. So yeah, absolutely. Can I take over the screen now, Vicky? All right. So obviously we're talking about regenerative medicine, regenerative aesthetics, and peptides using things like ozone and procaine. Just some disclosures. This is part of my training academy. So if you're part of the training academy, you might see this again sometime. So a little bit about me. I am certified through the Institute for Functional Medicine. So if you're a new practitioner and you want to learn more about functional medicine, I think it's a great program. I think it's very comprehensive. It's a rigorous program, but it does give you the core foundations to really understand from a holistic, just all the different systems and how they intertwine and work together. So if you have any questions about that program, I'm happy to answer them as well. I'm boarded in family practice and pediatrics. I've also have a couple peptide certifications. I won't get too much into that. I also do a fair amount of pellet therapy. And so full disclosure, I do some work with BioT and do speak for BioT as well, which is just a pellet training marketing company. I've done a fellowship in aesthetics through the Academy of Anti-Aging. And one of the biggest things in aesthetics is there's no like certification where it's kind of one of those things, anybody with a syringe and an Instagram handle can be like a master injector, which is extremely frustrating when you try to stay up to date on things and you want to be, educated. So that was probably the closest I could find to like a certification, a fellowship, something. So that was also really good. I'm also a trainer for Galderma and just speak and conference and got to present at SopCon last year. And so I love it. I have a training academy. You guys have any questions about that? Feel free to let me know. So why regenerative aesthetics? I know there's a fair amount of injectors on this call, which is great. This is where medicine is going when it comes to aesthetics. And what the goal is we're trying to help your body repair, replace, and regenerate your own tissue. So think about the aging process, right? There's autophagy, there's oxidation, there's cell damage, there's all kinds of different things that are happening. And what we're seeing in our patients is they want natural, they want low downtime, they want things that can help their body just do things naturally. And so these are things, if you already do aesthetics, these are considerations, and we'll talk a little bit about that, is your bio-stimulations and your growth factors and things like that. So not to get too far into the weeds, just as Jason said, if you want to get into the deep weeds, you come see me and Kim on site. But we're going to kind of talk a little bit about some of my favorite peptides, how I use them, how they work, a little bit about ozone therapy and how I actually use it as an injectable. We'll talk a little bit about procaine therapy, which I know one of my good buddies is on this call. I saw him on here. He's an anesthesiologist. And so I'll be really curious to hear what he has to say about it. Some of the other different modalities of using the mix of all 3 peptides, ozone, and procaine in as far as aesthetic management. So thinking about things like delayed onset nodules. There's a condition called ASIA, which is autoimmune systemic induced adjuvant. So thinking about those delayed onset nodules and autoimmunity that can take place with that, and then managing vascular occlusion, like how would you use this in practice? And then maybe some of the legal and ethical considerations when you're talking about these things specifically on social media, because it can be a very sticky place. So just some facts. 2023, rise of aesthetics for minimally invasive aesthetic procedures. There's definitely a trend in the shift of a mindset, less is more. You're seeing a lot more people want natural. They want not the overfilled cheeks or the maleficent face. They want natural. We always, me and Carmen, my nurse injector, we call it the undetectable injectable. So I always say, look at the before and look at the after. You can clearly see the after is better, but you cannot tell what is better about it. Then I know I've done my job. If you're looking at things like social media platforms, again, you're going to see a lot more use of things like calcium hydroxyapatite or Radiesse, or things like PLLA or polyalactic acid like Sculptra. The other thing that you're going to see as well is that with the rise of telehealth, telemedicine, teleconferences, just as we're doing here, people see their mug a lot more on screen. And so they're like, oh my God, why didn't nobody tell me my forehead looked like this? Or why didn't nobody tell me I had bags under my eyes? And so people see themselves a lot more. And there's just a lot more awareness of what the hell is your face doing when you're talking? So I think these are all big things. And then the other thing is, and this is what I love about what I get to do as far as optimization in women's health and working with women who are like, they're getting older and they're going through perimenopause and they're not taking the shit lying down. So like, how do I look good? How do I feel good? And how do I do this in a very safe and natural way? So that's why I feel like this industry is going to be booming. And so if you're a practitioner and you're like, I'm into this, let's do it, you're already 10 steps ahead of the rest of everybody else. So when we think about biostimulation or regenerative aesthetics, think about your most common modalities that you do in practice. And so those are things like your radio frequency microneedling, traditional microneedling, microdermabrasion, any kind of light therapy, laser resurfacing, peel. So what we're doing is we're causing either little traumas, little damages to the epidermis or the dermis, depending on how deep you're going, and you're causing the process of healing to turn over. You're turning over new skills. Using things like hair restoration treatments and exosomes or PRP or PRF. Now, those are kind of like the basic stuff we see in aesthetics. How we're going to take it up a notch is we're going to use other modalities like our peptides, our ozone, and things like Procaine. So not to get too far into the weeds here, but let's talk about the aging face and kind of what happens. If you're an injector, I'm sure you've seen this face a lot, but there are a fair amount of people in this class who are not injectors. So what happens as we age, we lose hormones and we lose collagen and we lose the facial fat pads in our face. And when that happens, they start to shrink in the mid face and then they start to descend. So they shrink and then they descend. Pair that with shitty lifestyle, poor diet. If you drive a lot and you travel a lot, the left side of your face is going to look a little bit more photo aged than your right side of your face. If you're on the glutide and you've lost a lot of weight, like everyone's like, great, I'm skinny everywhere else, but now I have these like marionettes and these jowls. So this whole process is like everything's kind of shrunk and descended. And now you have life to heavy nasolabial folds. You've got the life to the pre-gel sulcus or the marionettes, and everything's just very, very gaunt, right? And so what our goal is to try to restore and try to kind of build back the structure that was already there. So again, looking at things like hormone optimization, we have estrogen receptors everywhere in our body to include our bones. So when we age and our estrogen receptors decline, think about that recessed chin. So as we get older, that chin starts to recess. So that's where you're going to want to start doing some chin contouring or some chin shadowing is what we call it in the aesthetic world. The other thing that can happen is that the sagginess or the loss of elasticity and collagen in your skin, that's also going to give life to the crepiness, or we call it the accordion lines or the vertical lip lines or smoker lines around the mouth. So these are all things we look at from a completely comprehensive aesthetic view. So this is the picture. This is the aging process. The whole process is happening on the right. You're losing collagen, you're losing estrogen, you're on the glutide, you're getting skinny, everything's just fallen and it's now in your shoes. And now you're on my doorstep like, Lexi, help me. What the hell do I do? Right? Okay, so let's talk about what we already do in aesthetics. And these are the things that if you do aesthetics, you probably already know them, right? Know them. So you've got your CAHA, which is your calcium hydroxyapatite. Those are things like your Radiesse or your hyperdilute Radiesse. Looking at things like polyalactic acid, which is PLLA, that is your Sculptra. So those are your biostimulators where they're going to stimulate either type 1, type 2, type 3 collagen, all those things. Looking at things like PDO threads. So PDO threads, there's polydioxanone. So think about these are like dissolvable sutures. So you're going to get two mechanisms with that. You're going to get the retraction of putting in the PDO thread. And then as the PDO thread breaks down, you're going to get that little stimulation of collagen and tightness around it. And then microneedling. So these are all natural ways to stimulate collagen and to stimulate kind of like that healing cascade. So if we look at this picture on the left, this is me using Sculptra to tighten up. This chick already had a six-pack. Okay, let's be honest with her. I'd be happy with it before. But she had a little baby, and so she had some skin elasticity. And so we use Sculptra. And I think that might have been 1 or 2 treatments. And so you can see she went from like sculpted to even more like yoked. So there's that. Then you've got the lady in the middle there. Again, these are all pictures of my patients. And so this is what I love about Sculptra. It's like, look at the left and look at the right. The right clearly looks better, more youthful. She's a little softer in the nasolabial fold. She's a little softer in her transition from her piriform. She's a little softer in the transition along the mandible, looking at the prejaw sulcus. But you're like, it looks better, but I can't tell exactly what looks better. Also, look at her temples. She went from being kind of like a little bit of hollowness where you could see her temporal suture line to the transition. She just is more, it's like pan facial. It's just more well-rounded and she looks youthful. And then this one, I think this was probably during the Rona. You could see I got the mask on and I'm putting some PDO threads into that patient. So again, this is normal biostimulation. This is what we do in aesthetics. Okay. So again, why biostimulation? Natural, non-surgical. People want those natural type things. And again, you're going to activate your own body's natural fillers. I thought this was really interesting. I can't divulge the source of where I got this from, but I've got sources. And so one of the things that I've seen across the board, being a trainer for a, aesthetic company is that filler sales are down, but biostimulator sales are up. So in 2023, Sculptra sales were up by 25% and Wrestling Classic was down 14%. So again, just going back to people are looking for this. So if you add this in your practice, you're like, all right, I'm ahead of the game here. I'm going to give people what they want. That's what Carmen always says, just give the people what they want. So what is a peptide? So a peptide is a short chain of amino acids. So these are like the building blocks of proteins. And so what we use peptides for are different cell, like cell messengers, cell receptors. They do different things in our body. Proteins have longer chains of amino acids. Peptides are typically shorter chains of amino acids. So what do we do peptides for? So again, peptides can do lots of different things. They can act kind of like a hormone. So if you think about a peptide like kisspeptin, which unfortunately is no longer available, kisspeptin can kind of act like an HCG or like human chorionic pregnol. And so what that does is it can act by increasing the natural production of the Leydig cells, which then stimulate endogenous production of testosterone. So that's like one way. Look at something like Semorlin. So Semorlin is another type of peptide that helps act on the pituitary gland to increase your natural production of growth hormone. So I'm not giving you HGH. I'm giving your body the batter to make its own HGH. So it's a great way to minimize side effects, but maximize some of those benefits. It can fight against the aging process. So some of my favorite peptides to do this are things like rapamycin or sirolimus. So those are like your anti-aging. Those are going to help with telomere and autophagy and things like that. Regeneration. So our regenerative peptides, and that's a lot what we're going to talk about here, which fortunately are still available. So those are things like our BPC 157, our thymosin beta 4. Regulation of appetite, digestion, and metabolism. So we all know this, the favorite ones, right? Semaglutide, tirzepatide, or liraglutide. So they've been around a while. Reducing inflammation, again, going back to some of our regenerative ones, looking at BPC 157, acting as antioxidants. So think about your mitochondrial peptides. So those are like old school MOD-SC, new school, looking at things like SS31 and humanin. Delivering messages to different blood tissues. So again, thinking about regeneration, we want to increase the process of VEGF, which is your vascular endothelial growth hormone. And so what that's going to do is it's going to increase nitric oxide, which we know about nitric oxide, right? You increase blood flow, so does ozone. So do you see how it's like all coming together on a cellular level, like, oh, well, this does that. And so does that. What if we pair that together? What kind of like synergistic effect is that going to have? And that's where really this is like, see, it's coming together here. Some other things that it can serve as is an antimicrobial. So there's a peptide that I'll use, and I'm going to talk about it. It's called KPV, and that's a tripeptide, and that can be an antimicrobial. It can be an antifungal. I use it in Candida. It works really, really well. And then some other peptides that just, you know, they either work synergistically with a peptide or they act as cell signaling kind of receptors. So here's kind of some, and this is like a good screenshot. So if you want to get your phone out, screenshot it, like what the hell did Lexi talk about? These are the peptides I'm going to talk about. So BPC 157 with KPV, GHKCU in topical format, argirellin, span-8, lufazole, and then thymosin beta-4. And I put the formulation specifically capsule, topical, because if you've been doing peptides for a while, you know that in September, the FDA came in, recategorized these bad boys. And so this is what is left over. If you come to the mastermind, I will teach you where these sources are at. All right, next section. So this one here, hold on, this like little bar here, I can't see. Okay, this one is argirellin. So argirellin is a unique peptide in that it acts on the snare complex, which that is, think about what your neurotoxins do. So neurotoxins like your Botox, your Dysport, your Xeomin, your Jeuveau, and then, oh my God, I'm blanking on the last, Daxxify. So it blocks the contraction. So you're blocking the release of acetylcholine. Acetylcholine is what causes contraction. So therefore, by blocking it, you will not be able to move those muscles as much as you once did. So a great way to use this topically would be like a serum, right? So maybe like a post you cleanse, you exfoliate, you tone, then you serum, right? So we talk about layering your aesthetic products. That would be a good one to add as like maybe a nighttime serum. I actually have patients do it daytime and nighttime, but it can be very, very good. Rarely do I prescribe this by itself. Like it's usually in combination with argirellin, lufazole, and GHKCU, and it comes in like a bottle. It's usually blue, but usually with other things. And so this was a great picture. I listed the source there. So if you're going to see any pictures, if they're not my pictures, I will always put where the source is. So if you ever want to go back, check out that article, put it in your Zotero. It's great. But you can kind of see there, you know, if so, think about your patients who are super, maybe I don't want anything injected in my face, but I'm like, why? These are the good options for the patients because this is a topical option for them. All right, next one. So this is the SNAP-8. Again, it acts very similarly to your argirellin by basically acting on that same contractility receptor to help diminish the depth of the wrinkle. Again, this is often going to be used in conjunction with argirellin peptide. I had a picture here. I don't know what happened to it, but there is the article where that came from. This one here, this is actually my patient. So this is where we did lufazole, argirellin, and GHKCU. So this was a serum that we did. We did it in the morning and at night. And so you can kind of see the before and the after. She was very tight. She doesn't get any injectables. This was all topicals. And I want to say that was probably like 3 or 4 months, of use. And so you have to be consistent with it. And you have to be very, very, you know, we do this in aesthetics, setting up realistic expectations. Is this going to be a facelift? No. Is this going to be the same as biostimulation like Sculptra or Kaha or whatever you're doing? No. Will this help? Yes. So this was a great before and after in that she knew she didn't want to do injectables, but she was stoked. She was stoked about her results. All right, next slide. So this is GHKCU. So GHKCU, this has so many benefits. This can help as an anti-aging. This can stimulate collagen. This can do wrinkles. It works really, really well. Back in the day, we used to have it as an injectable. So this was one of the injectables that I use in my hair protocol. Unfortunately, I can no longer get it as an injectable. So when I say no reported side effects, it burned like hell when you would inject it because of the copper in it. But now they can't inject it, there's really no side effects with it, which is great. It's also great for patients who have sun damage as an antioxidant. So this one can be a great option. It also works by directly impacting things like your fibroblasts. So those are things that are going to stimulate collagen, elastin. So these are all words, if you work in aesthetics, you know, like, oh, I've heard that before. Oh, I know this product does that. So they work very similarly in tandem with all these other peptides. So how do I use GHKCU? So now we can only get it as like a topical. So think about things like skin, neck, décolleté, chest, right? Crepey arms, stretch marks. I do have some people using it in their hair, fine lines, wrinkles, skin damage, hyperpigmentation. In the serum, just so you know, if you ever put it on right directly after microneedling, it burns because those wounds are fresh. So I would wait like probably 48 to 72 hours before you put it on a face if you're doing procedures. All right, here comes the good stuff. So here's BPC 157. So BPC is body protection compound. This is a 15-chain amino acid. It was actually discovered in the gut, and I use it if you do gut health. Like, this is a tool you need to have in your toolbox. This is great for anti-inflammation. It's awesome for MSK. So MSK is musculoskeletal. So if you do anything with joints, any kind of like regenerative tears, anything like that, you need to have this one. With it being a capsule, it's extremely well tolerated, really well tolerated. I use it like a probiotic with my patients. I'm like, you take it with your probiotic kind of thing. As a serum, it works very good for accelerating scar healing, wound healing, all those things. So when you're doing scar regeneration, thinking about using your system of, first I'm going to do the Procaine, then I'm going to inject the ozone, then I'm going to prescribe them BPC 157. So it works very well in conjunction with all those things. It does a mechanism by increasing nitric oxide. So again, you increase nitric oxide, you increase angiogenesis, you're going to increase the blood flow, which then increases healing properties to that area. So this is a great picture of a scar. I think this was a mouse study. But what they showed is using BPC. I'm not sure if they did it as an injection in the study. I can't remember. But this was a great before and after. And this is, if you've seen any of my Instagram, you will see lots of before and after scars. BPC, GHK, and TB4 were the three peptides along with Procaine and ozone that we use for those regenerative type things. It can also help with the stimulation of collagen, blood vessels, and just really promoting strong, healthy tissue. So as a mom, we have this GHK BPC as a tube. And so when someone has an owie, that's what we put it on. So it works really well. Another peptide that we use is thymosin beta 4. So this one is a little bit of a longer chain amino acid. Just as I said, BPC is a 15 chain. This is a 43 chain. Thymosin beta is a very unique peptide. So think about where your thymus gland is. So it kind of sits in your breastbone or in your sternum. Your thymus produces two types of peptides. It produces thymosin alpha 1, which is your immune boosting peptide, and then thymosin beta 4, which is your regenerative type peptide. And so this can be really helpful for people who have had any kind of damaged tissue, any kind of injury. I love to give this as an injectable to patients who have just had surgery, mommy makeover, torn ACL, anything, any kind of surgery, gallbladder, any of that. It will help with accelerating wound healing, not only from a scar, but just tissue repair. Think about just supporting tissues. It can also help with enhancing collagen, and then also working on those that endothelial layer by increasing angiogenesis. So it's another really good peptide. So this is kind of just like an overview of like some of the different types of injuries you can use it in, to get not too far into the weeds as far as cellular medicine. But I love this chart because it talks about specifically what signaling pathway it's going to impact. So we talked a lot about VEGF, which is that vascular endothelial growth factor. That's a lot where PRP works on, where ozone works on, where methylene blue works on, where Procaine works on. So think about this as like different highways. We're just like hitting that highway again and again, just in different ways, which is so great to see, is that you're not going to exhaust one modality. You're going to use them very synergistically because they all have a lot of pleiotropic effects. So this is a great picture of, I had a patient come to me, and she was seeing a local practitioner who really specializes in a condition called BII, which is breast implant illness condition. I don't do anything with that. I say, I can offer you some ozone. I can work on your gut. I make no guarantees though when it comes to BII, only because there's just a lot of new emerging research, and I haven't seen a lot of good protocols with it yet. But anyway, so this patient told me that the guy who was helping her with BII injected PRP in the scar. And I was like, interesting. And so she asked me, you know, like, do you have any other recommendations? And I was like, well, step into my office. And so we did GHK, TV4, and BPC. And I said, hey, would you let me treat just one of your scars and then not treat the other one? And she's like, okay. And I go, because I just want to show what the difference of utilizing peptides can be so powerful with very little downtime, very little side effects, which is, especially if you know anything about BII, like those patients are very sensitive to everything and anything. So the left side of the boob here, that was treated with PRP. The right sided was treated with PRP by that other provider, but I just treated them once with peptides and advanced growth factors. So I use a product called VidiPure, which I believe Doug is one of the speakers in one of the, I don't know if it's next week or the week after, but he can talk a lot about the advanced growth factors. So you can see the difference. Look at the healing ridge, look at the erythema around the border, look at the like, you can't touch it, but look at, if you run your fingers over it, you will see how much flatter it is compared to the left side. So this was a great before and after. This is one of the hair protocols that I did on this patient. So this patient on the left of the screen here, she was post-COVID hair loss. Lost a lot of it. And then we did BPC, GHK, TV4. We also paired it with some advanced growth factors. And then same on the right. That the lady on the right, she was, I think, I can't remember what her hair loss condition. It wasn't post-COVID though, but she did lose her hair. So let's talk a little bit about Procaine. Again, not getting too far into the weeds because that's what Kim's going to do at the mastermind. But Procaine has been around a really long time. So Procaine is in the family of anesthetics. But what's kind of unique about Procaine is in the 60s, they studied it as a anti-aging drug. And so there's a drug that came to market called Gerovito H3. And so not tons and tons of research on it, but there is a lot of research about using neurotherapy. So neurotherapy would be IV Procaine. And again, if you come to the mastermind, we'll tell you exactly like this concentration, there's like a whole chart and all kinds of things. But what neurotherapy does is it works in a couple different ways. It can be super helpful in things like chronic pain. It can be helpful for scar regeneration. It can help as an anti-inflammatory. It can help as an anesthetic, because if you've ever injected ozone in the tissue without an anesthetic, it burns like hell. So I love to use it as the anesthetic before I inject the ozone in it. But what it does is it kind of acts, I know it sounds kind of like woo-woo, but it acts on these ions where your body is kind of holding this kind of this barrier. And that's what's kind of like holding in this pain or this trauma. And when you inject the Procaine, what it does is kind of like resets the ions so your body can release them. So what you notice is that you get an improvement of pain, improvement of injury, improvement of inflammation. But not only that, the cognitive piece of it, your mood is lighter, everything seems brighter. So in clinic, what I use it for things like seasonal affect disorder. I use it for depression, anxiety, PTSD. I don't use ketamine, but I'd almost imagine like if I were to recommend maybe ketamine to a patient, this is probably how I would use it as well. There's a concept, there's a book, it's called Your Body Keeps the Score. And it's kind of like every time you've had surgery or every time you've had trauma to your body, it's like your body's holding on to it. So it's harder to penetrate through some of that barrier. And so what IV Procaine does is it kind of resets those charges in those cells. And that's how you kind of break through some of that. It works very closely on that autonomic nervous system. So that's kind of like an overview of how that works. Again, Kim will get more into that. So how can we use, or how can I use neurotherapy into aesthetics? So as far as microneedling, I have done so I use BLT cream, I microneedle, but I also do, like, I will pull up Procaine in like a little beady syringe, and I will do it like little injections along where you might see really bad acne scars. Because what I'm going to do is once I inject that Procaine, so think about, I'm using the Procaine as an anesthetic, but I'm using it for its properties in releasing some of that scar tissue. Then I'm going to take a cannula and I'm going to subcise through that tissue to kind of break down some of that scar tissue. So you're getting multiple different modalities of how that's going to work. The subcision is going to help break up that scar tissue from like a manual manipulation, but the neurotherapy is going to also help break it up from like the charges, the ion charges of the cell. So this is a great before and after. So this is a patient of mine. So he's on BPC capsules, TB4 injections. I didn't inject it actually into the tissue. I sent him home on the injections, and then he's on topical GHK. But again, I used microneedling, BLT cream. Then I do Procaine. Then I subsized the scars. Then I injected the ozone. And then I send him home on like a recovery cream, all those things. We use it as some cryo elixir. So we use some advanced like growth factor type things when I microneedle into his skin. And that was after one treatment. So you can see he was really red and really inflamed, but man, it works well. So ozone, how it works. So again, this is not about me teaching you ozone. It's about how does this relate to all those other things in regenerative aesthetics. So ozone is a gas. So O2 has 2 molecules, O3 has 3 molecules. And basically what that does is it activates, remember I showed you that picture of TB4 in those graphs. It activates all this cascade of regenerative and healing type injuries that then hit the signals. It triggers the signals. The other thing that it does is it can help with controlling inflammation. So it creates almost like a little bit of hormesis. So there's a little hermetic stress. So when you think about hormesis, think about small little trauma to their body to trigger your body's ability to heal itself. So those are things like intermittent fasting. Those are things like cold plunging. I know Dr. Ellis is a huge cold plunger. Those are things like red light therapy, sauna, all the rapamycin. So these are all different ways to trigger low level of stress in a very controlled environment in order to signal those pathways of VEGF and NF-kappa B and the nerve complex and all these other things. So it's a great way to use systemically through an IV, but it's also great to use. I've used it in joints, I've used it in scars, I've used it in aesthetics, I've used it in vascular occlusion, I've used it in a lot of different ways. Some other things to consider, and we do carry this inside. We don't make it, but there is a company you can get it through. You can get like an ozonated oil. So I've had patients put it on scars. I've had people put it like on like cold sores. I've had people put it on like post-injection. And what that's going to do, it's going to help activate some of that healing cascade, but it also can be great as an antibacterial, an antifungal, and an antiviral. So using ozone as an injectable, again, this is not my patient, but this was a study that I found where it did have some pictures, 2021. And so they used, you can see there, they used 1 milliliter of 15 gamma. If you don't know what 15 gamma is, then you really need to take an ozone course because they will teach you what that is. I didn't know what the hell it was either until I took an ozone course. And so you can see they almost use it almost like what you would inject around the crow's feet. They did 8 sessions, one time every 20 days with a volume of 1 milliliter, the dose of 15 gamma. So I think it's really, really neat to kind of see, well, shit, I can use it as an injectable too. Ozone and vascular occlusion. So again, this was kind of one of the things that I use it for because I know how it works from a cellular level. I knew it wasn't going to harm my patient. And so this patient had a vascular occlusion and she was a 26-year-old female, presented 24 hours post lip filler. Her presenting symptoms was delayed capillary refill and pain. And she's kind of pale baseline, but what we did, and you can't see it on here, but we did there's a capillary refill test that you're going to do, and we did it on video. And so you could count the delay. Product was Restylane D-Fine, but it can happen with any product. The technique that I used was a direct needle, and I was using a fencing technique, trying to get some vertical height there. And so the symptoms she presented were pain, pallor, delayed capillary refill. So what I did with her is, fortunately, we have ultrasound. And so I was able to see, now it's really hard to see in a lip just because that area is so tiny. But you can see where the cannula is going, where the ozone is going. And so we did warm packs, inject the cannula, inject the ozone, warm packs. And I would say probably within 10 minutes, the capillary refill was so much quicker. So it worked really, really well. It needed one treatment and it was done. Delayed onset nodules. So in aesthetics, if you're not familiar with what this is, this can happen post filler. And what it is that it can be a couple different reasons. It could be a hypersensitivity. It could be something like a biofilm, which a couple cases I've been involved with. I've never been the injector, but I've always been the one to help. Granulomas or systemic issues. So one of the systemic issues is like, let's say their body triggered an autoimmune response, and now we've got this this delayed onset nodule. And so with this, it can feel like a hard, lumpy mass, is basically what it feels like. And it can be anywhere that you've injected. So the 2 cases I've been involved with have been in the mid face, and one has been in the lower marionettes. Product choice can play a huge role with it, the depth at which you're injecting, and how the product settles. So as far as a clinical case, and this one's actually really interesting. So clinical case is a 36-year-old female, past medical history, negative for autoimmunity. And why is that important? Is because as someone who takes care of a lot of patients of autoimmunity and someone who does a lot of injectables, these are things I want to know. Have you had any flare-ups? When was the last time you had your CRPs checked? When was the last time you had labs checked? How often do you have flare-ups? Are you on any immunologics? Have you ever had injectables? Any issues with those? So this patient, again, I was not the original injector. She had voluma in her face placed bilaterally to the mid face and lips. She had bursa back in March of 2022. In May, she had the vaccine shot booster. In July, her lips started to swell and harden out of nowhere. It was not triggered by anything. She went to that previous injector and it dissolved it without any issues. But then a month later, she's developed some pain and burning in the mid face. The injector did 3 sessions of Hylenex, a steroid pack, and put her on Doxy for 2 months. And all I could think is like, oh my God, this lady's microbiome has probably gone to shit now. Her symptoms improve. However, she occasionally had burning to her face. So when I hear burning, I think of a neuralgia. I think of, is there something going on with her trigeminal nerve? Like what is happening there? So when she came in, you could feel a palpable hard mass right along her cheekbone. So we were able to ultrasound and visualize it under ultrasound. And so it looked kind of like a little hard opacity on imaging. And so what we did is warm pack, Hylenex, ozone, and it was like an immediate relief. Now, I don't know how much of that was placebo. So I had her follow up 4 weeks later, and the pain still did not return. Now, the plot thickens. Interestingly enough, of course, she's like, well, what else do you guys do here? And I'm like, well, we do functional medicine and all those things. And so, of course, you want to get her labs drawn. So if you look here on this chart, and the EMR system I use is called Serbo or MDHQ. If you're in functional medicine, it's an awesome, awesome system. I get no benefit of saying that. I do think it's a great system. So if you look at her May labs there, I threw on here, she had some elevated LFTs, but I also checked her CRP, because that's what you do when you're a nerd in functional medicine, is you want to look at their inflammatory markers. So CBC, CMP, I also checked all her thyroid and her hormones and her Ds and her Bs and all those things. But look at her LFTs. Her ALT came in at 96 and her AST came in at 54. And I was like, what in the hell just happened here? So I went through like fatty liver. This chick is fit, like walks around 15% body fat. So like, that's probably not it. I asked about like any other drugs, alcohol. No, she's got 2 little kids. She rarely drinks, doesn't do anything. So I'm like, okay, could it have been the doxycycline that the previous injector had her on for 2 months? Maybe, I don't know. So in my true integrative ways, I was like, all right, well, let's try some castor oil packs. Let's get this liver to detox. Let's get your fiber. Let's get some milk thistle. Let's get some antioxidants. Let's get this going. And so I brought her back 2 months later. They came down slightly. And then I was like, okay, I don't really like that. And so she was like, oh, you know what? I took some Tylenol before I had that lab draw. And I'm thinking, it's probably not going to do it unless you like really took a lot of it. I was like, okay, come on back a week later. So you look at the timeline, July 17th, July 25th. Shit, they're even higher now. I'm like, madam, you're going to have to go to a hepatologist. Like, this is not my wheelhouse. This is not what I do. So she's like, okay, so she of course takes forever to get into a hepatologist. In the meantime, she's like, can we check labs one more time? I'm like, sure. So they just kept rising. So she has seen hepatology and they think she has some sort of autoimmune hepatitis. I don't know what the trigger was, but could that delayed onset be that Asia condition? I don't know, maybe. So of course she's like, well, I don't want to do anything pharmaceutical. I want to do some more natural stuff. And this is what I always say. I am happy to work with whatever your providers recommend, if they're cool with it. And a lot of times patients, they want to try to take a more natural route. And I would say, I'm never going to say, don't do that. If that is what your doctor is recommending and that's what you want to do, you need to do that. So my recommendation, and I think she's coming in like in a week or two, my recommendation is going to be IV ozone. I'm going to start her off at a standard and then I'm going to move her up to a high dose. That's how we always started. I'll do the workup. I'll check all her blood work, CBC, CMP. I check G6PD on all my ozone patients, just in case we want to get up to the high dose. I would send her home on thymosin beta-4 sub-Q daily. I'd also put her on LDN, low-dose naltrexone. That is not a peptide, but that's going to be a huge support for her autoimmune system. I'd probably put her on a little bit of methylene blue and then BPC 157 with KPV capsule on that. So I think that's it. Yeah, there's my references. So how to sign up. I know Vicky has all that contact information. If you have any questions about the training academy, you can email my assistant, angie.morgan@edirecthealth.com. If you're into podcasts, I have a great podcast. There's all kinds of episodes and it's geared towards patients and practitioners. If you're interested in any kind of training with me, I've got a website, YDH Training or YDH Academy. We have an Instagram handle, and then the podcast is the Better You Project. Okay.
Amazing, Lexi. You're awesome. So thank you so much for going through that with everyone. Guys, if you have any questions, feel free to throw those into the chat. We'll go through, have a quick Q&A for anyone. So anything that Lexi spoke about, feel free to ask what anything you're thinking. I do want to fill you in on a couple of things while you guys are typing in those questions. First is the part 2 of this series is going to be April 2nd. It's going to be peptides and human cellular tissue sourcing. Regulatory requirements with Doug Rainey. So you definitely want to be a part of that. As you know, what there used to be called stem cells. I want to go old school. They used to be called stem cells. Then there were exosomes. I've heard them called extracellular vesicles. So yeah, even just tuning into the webinar to know what to call them in 2024 is probably important, but he's going to give you a lot of great information there. The third part of this will be using peptides to combat weight loss. Drug side effects with Chase Baldwin. So he's with Body Health. So if you are familiar with Perfect Aminos, that supplement, this is your guy. He is amazing. So we definitely want you in for all 3 of these coming webinars. The last thing I was going to tell you is if you have let's say you want to take this a step further, if you want to find out if this class is right for you that we're offering in person in May 3rd and 4th in Noblesville, Indiana, you can have it would be a complimentary 15-minute consult with Kim Look or myself. You can schedule those. There'll be a link that's going to be sent to you guys on that. So you can go through and ask us any questions and we can find out if this is right for you. But let's look at some questions that we have here. I know that a few have come in. Lexi, if you want to, I see you reading them. So if you want to jump in and answer those, you can. If you just want to read the question so that everybody can hear it on the recording.
Sorry, I'm trying to find where the questions start. Scottsdale. Okay. You also would see screenshots. No, I don't think that's anything. People are sourcing about Procaine. So with sourcing, that's going to be state by state dependent. I know that Kim's working really hard, and I know Vicky's working with her on getting people a list of where you can get those things. I am able to get it from a local pharmacy in my state, but I don't know if they're licensed in your state. I know that Versiti, I always say it wrong. It's like Vercesis. I know that they can make some of those. I believe they do make Procaine. South Lake Pharmacy, I think, can make some Procaine. I know McGuff used to make it, but I don't know. I think they're like in California, which I say California is like the fucking Bermuda Triangle. Like if you're in Cali, good luck. I don't know.
Star is who has Procaine currently.
Texas Star.
Yep. So Kim just sent me the telekinesis message.
Oh yeah. Sounds just like
Texas Star has that. Also, they have methylene blue. So just so you guys know, didn't mean to jump in there, but new BioAge has methylene blue as well. I know that Lee Silsby has it too. You unfortunately have to play this like musical pharmacy chairs with methylene blue and just skip around and jump and get like accounts everywhere. So I can be a good resource for you there if you want to reach out to myself or Kim. We usually know all the hot sources, but keep going, Lexi. My apologies.
Yeah, absolutely. Let's see here. It's going to be recorded. Source for methylene blue. Already got that. Procaine for California.
I got a good question for you. Have you seen any better results of BPC 157 injection versus capsule for joint health, injury, and so on? So that's an awesome question.
Yeah. Oh, there it goes. Okay. So if you're doing it for gut health, capsule, hands down capsule. If you're doing it for joints, injecting in the joint, I feel in the patients that I've seen way better. Good luck trying to find it and it is as an injection. So that's the only thing is you can't get it as an injection, at least in our state, we can't. But yes, if you're doing it for joint, for sure, injection. If you're doing it for gut, I would do a capsule. How often do you recommend high dose IV for liver patients? This is a great question. I would say it's going to be totally patient dependent on a couple things. What is their hepatologist doing with them? What are their LFTs doing with them? Thinking about, are they getting any kind of Herxheimer response? So the doc thinks that she has a viral hepatitis. So if I'm doing ozone, I will probably be doing some IV glutathione with her, which Kim and I are going to be covering that in the mastermind. We'll probably be doing some sort of like castor oil packs, amino detox, something to detox her system, because there's obviously some nastiness in there, and so we got to make sure that those pathways are up. So I would say typically maybe once a week. So the way I describe it to patients, and this is a great analogy. So one high dose treatment is the equivalent to like 2.5 standards. So if time is of the essence, as I say, time is money, then I would love to do it like one high dose every other week for 4 to 6 treatments. I think would be a great protocol. And in the meantime, I either might have them coming in between for like a Myers and a glutathione, or a Procaine and a glutathione push kind of thing. Let's see, can you use BPC for ulcer? 1000% you can. If you're trying to help someone with ulcerative colitis, I would actually do BPC with KPV, and New BioAge has that as Peptides, and that is considered a nutraceutical, and so you can get that pretty easily now. But I would pair it with KPV if you're going to be using any kind of inflammatory, UC, Crohn's, yeah, something like that.
There's also a special protocol that you can use with rectal ozone for ulcerative colitis. It's pretty impactful. So speaking to an ozone guy, my brain goes there first.
Yeah.
But absolutely. Dr. Nario, yes, Lee Silsby for methylene blue is one of them. I'm glad you're here too.
Yeah. Jason, do you want to answer the last one? What types of benefits?
So what types of benefits have you seen with ozone and or EBU with long haul COVID? Unfortunately, long haul COVID has been, I'd say, the #1 patient demographic for EBU. Unfortunately and fortunately, right? So you have an awesome tool in that. EBU uses a lower concentration of ozone versus any other ozone IV. So, earlier Lexi had talked about if you don't know gammas and concentrations of ozone, you need to take an ozone class. Guess where you take an ozone class at? You're talking to Kim Look, myself. We can get you caught up with all that. You can email Vicky if you have any questions on jumping into those classes or how to get information for that. But as far as EBU, it's using a lower concentration of ozone, so you don't have as much of an oxidative stress event from it. So when ozone comes in contact with a red blood cell, you either get reactive oxidated species or lipid oxide peroxides. So when you're using EBU, you're using a lower concentration of ozone, which puts off, you kind of shift it, not as much ROSs and more LOPs. So with that being said, I would say that I have seen a lot of awesome results from EBU with long haul patients. Methylene blue is also done as a, you're running it into the return line of that therapy. So you're just piggybacking it right in. So that's been epic, but for sure. All right, Dr. Nario has a question for you, Lexi. When do you decide to use plain BPC with BPC KPV? Where do you, again, sourcing question on your your super combo there, I guess I should say.
Yeah. So Dr. Melvin, I like to use that with patients who have any kind of really bad gut issue. So in our practice, we do tons and tons of GI maps. So with them, I'm typically going to like do a 5-hour protocol, and I'm going to see what sort of dysbiosis do they have. Is it like an insufficiency dysbiosis where I have to kind of rebuild the microbiome and give it the good stuff? Or is it an overgrowth dysbiosis? So thinking about things like SIBO, Crohn's, ulcerative colitis, if they have candida, if they've got like I had a patient today, she had a parasite and candida and H. pylori. I was like, and you've gotten yourself BPC KPV. So the thing is though, is budget. So BPC 157 by itself is fairly inexpensive for what you get. PPC with KPV is a little bit more expensive. So if budget allows, and I'm like actively trying to treat something, I will do BPC with KPV for maybe 90 days. And then I'll think, okay, now we can go down to just plain BPC. But I have like, if people are coming to me for optimization, ozone is part of it. IVs are part of it. BPC 157 plain is part of it. So KPV, I tend to reserve for like autoimmunity. So think about what happens in autoimmunity, right? You've got genetic predisposition, you've got some sort of gut permeability, and you've got a triggering event. So if you've got, think autoimmunity, BPC KPV is a fantastic option for something like that. Where do you get argirenin and SNAP8? So, or Lufazil. So again, these are sourcing questions. You can check with some of those peptide pharmacies that we mentioned, especially like New BioAge. They use a lot of different resources. If you want to email me, I could probably help with some of those types of things, but it's going to be state by state dependent, unfortunately. And that's why I said Kim is working on a list. But it's like a game of play roundabout with the pharmacies. Sources for methylene blue, I think. Where did you say, Jason?
So Lee Silsby is one of them. New BioAge has it. Kim said Texas Star is another. So that should get you started there, Rebecca, for sure, as far as just getting, looking for that there. But guys, I mean, like we're mentioning, we truly want you to come to the in-person mastermind. So regenerative aesthetics has been hot. If you are not into this, there's a practitioner that I know that's not his forte, but yet he signed up for the event. He wants to learn about this and expand into his practice. I promise you, your patients are going somewhere to get this done. I hear about this so much, and I just keep kicking people to Lexi and being like, Lexi, or it usually goes through Kim and then to Lexi. But again, this has been such a hot topic. Your patients are very much educated in this. They're looking for these things. So if you can offer this and do it correctly and learn at a high level with Lexi and Kim.
So one thing I think I want to mention, because I know there's a lot of practitioners, and these are in my training academy, this is what they want. When you come to the mastermind, you are going to get my SOP, so my standard operating procedure. So this is the recipe. Like, what does your procedure nurse do? What does your staff do? From like the point of what are the materials you need? What are the consent you need? You will get all those steps. And that is part of what is included in the mastermind. You will also get a copy of our consent. You don't have to use our consent if you don't want to, but it gives you an idea. I can't tell you how many times I have shadows come in and they're like, well, can I get a copy of your consent? And I'm like, well, which one? And they're like, well, you have multiple consents. I'm like, do you use multiple peptides? Well, then yeah, every peptide needs its own consent. So you'll get a copy of that. And then you'll get a copy of our patient education tool, because one of the biggest things that you can do, I always say, you don't sell anything. You are educating your patient to help them make a decision on their health. And if they happen to buy some ozone and some IVs in the process of it, awesome. And so you'll get a copy of the patient education sheet, you'll get a copy of the consent, and a copy of the protocol, the SOP. And in that protocol are how many gammas do you need? What size syringe needle do you need? What type of BLT cream do you need? You get all of those details. And I feel like anytime I get a shadow, that's what people want. So we're giving the people what they want at this mastermind. So I told Kim, if you listen to the podcast from yesterday, I'm like, where was this shit 5 years ago? It didn't exist. It didn't exist. So we're making it exist now.
Shout out to the podcast that you did with Kim. So, Lexi, do we have your podcast name that we can throw into the chat?
Yeah. It's the Better You Project. It's on Apple. It's on Spotify. And you is spelled YOO, like super clever. The Better YOO.
Awesome. Yeah, thank you guys. We appreciate you guys attending much. LDN protocol, would
Yeah,
that be
super
Dr.
easy.
Ellis is
Yep.
asking?
So one capsule at bedtime, 1.5 milligrams per capsule. So you're gonna do one capsule at bedtime times 5 nights. If tolerated, meaning no weird vivid dreams, no headache, and no sleep disturbances, you're gonna increase the dose to 2 capsules, which is 3 milligrams times 5 nights. Then again, if tolerated, the final jump is 4.5 milligrams, and that's where the dose stays. So when you prescribers, when you go to refill it, I would refill it at a 4.5 milligram capsule, 1 capsule POQHS.
Done. There you go. You've been certified now in LDN. Please mail checks too. I'm kidding. Guys, thank you so much for joining. Lexi, do you have anything else you need to comment on? I just see some Q&As that are popping up. So before we go, let me make sure we're not missing anything. Can you do a neurotoxin and also prescribe this serum? So Dr. DeLucia is asking.
Yeah, absolutely. So you
Okay.
can't, I would wait about probably 24 to 48 hours to put it on, only because when you have that neurotoxin in there, you want to sit, you want to like let it marinate in those tissues, and you don't want to move it around. So absolutely, it works very, very well. So I have a patient where we're doing testing out a theory. Think about your fast neurotoxin metabolizers, right? What if you added GHKCU as a way to extend the duration, like how long it lasts? So I have a patient that I'm trying it on. But yeah, absolutely. Just I wouldn't use it directly afterward, but I would definitely put them on it in conjunction with your neurotoxins. Hey, if I ever go to LA, we'll definitely catch up. Thanks for the invite. Advanced growth factors. So I'm glad that you brought this up, Melvin. So I try to like lay very on the side of don't get in trouble on social media. So if you follow me on social media, you know that I'm always doing crazy stuff. And that our Instagram handle is udirecthealth_aesthetics. And so one of the things I try to never put on social media is this treats this. Like you would never see me put BPC KPV treats Crohn's disease, because that is a big red flag. You're making false claims about something. Same with advanced growth factors. So advanced growth factors would be what I would call stem cells or exosomes. So we use those products. We use Vidi Labs. We use Vidi Pure. I'm not paid to say that. We use Vidi, and that's what Doug is going to be talking about, I think, the next class. So I say advanced growth factors. So patients are like, what's that? But then when they come in the office, I'm like, well, this is what they are. And I'm telling them what they are. So it's a term that I use to be on the right side of the law, as far as I don't want people in my shit, as far as like FDA and things like that. I don't ever want to make false claims. I don't want to make false claims. So that's why I do that. Let's see. Is that it?
That's it. Guys, thank you so much for attending. If you have any questions, please reach out to us. You will get a follow-up email with this recording of the webinar. There'll be links to everything we talked about. We obviously want you to attend the other classes. Remember, this is part 1 of 3. We want to see you in Noblesville, Indiana, so you can become certified and learn about all these tools to bring into your practice. But thank you guys so much. Lexi, thank you so much for your time. We appreciate you. Vicky,
Yeah.
for organizing all of us and being the ringleader to this big circus that you have to keep in order.
For sure. All right. We'll see you guys in
See you
Noblesville.
guys. Y'all have a great evening.